Hi students, welcome to the new session of reproductive health. In the previous session, we had discussed about reproductive health, problems and strategies, and population explosion reasons and ways to overcome it. In this session, we will discuss about contraceptive methods which can prevent unwanted pregnancies and control population. An ideal contraceptive should be user-friendly, easily available, effective, and reversible with no or least side effects. It also should in no way interfere with the sexual drive, desire, and/or the sexual act of the user. A wide range of contraceptive methods are available which could be broadly grouped into the following categories. They are natural or traditional method, barrier method, intrauterine devices, oral contraceptives, injectables, and surgical methods. Now, let's see what are the various natural or traditional methods of contraception. Natural methods of contraception work on the principle of avoiding chances of ovum and sperms meeting. One such method is called as periodic abstinence. In this method, couples avoid or abstain from coitus from day 10 to 17 of the menstrual cycle when ovulation could be expected. As chances of fertilization are very high during this period, it is called fertile period. Therefore, by avoiding coitus during this period, conception could be prevented. The second method is called as withdrawal or coitus interruptus. In this method, male partner withdraws his penis from the vagina just before ejaculation so as to avoid insemination. The third method is called as lactational amenorrhea. It is based on the principle that ovulation and therefore the menstrual cycle do not occur during the period of intense lactation following parturition. Therefore, as long as the mother breastfeeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of 6 months following parturition. As no medicines or devices are used in these methods, side effects are almost nil. Chances of failure of these methods are also high. In barrier methods, ovum and sperms are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condoms are barriers made of thin rubber or latex sheath that are used to cover the penis in the male or vagina and cervix in the female just before coitus so that the ejaculated semen would not enter into female reproductive tract. This can prevent conception. Use of condoms has increased in recent years due to its additional benefit of protecting the user from contracting sexually transmitted diseases and AIDS. Both male and female condoms are disposable, can be self-inserted and thereby gives privacy to the user. Diaphragms, cervical caps, and vaults are also barriers made of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of sperms through the cervix. They are reusable. Spermicidal creams, jellies, and foams are usually used along with these barriers to increase their contraceptive efficiency. The use of intrauterine devices is one of the most popular and effective method of contraception. These devices are inserted by doctors or expert nurses in the uterus through vagina. These intrauterine devices are presently available as non-medicated IUDs, copper-releasing IUDs, and the hormone-releasing IUDs. IUDs increase phagocytosis of sperms within the uterus, and the copper ions released suppress sperm motility and the fertilizing capacity of sperms. The hormone releasing IUDs make the uterus unsuitable for implantation and the cervix hostile to the sperms. IUDs are ideal contraceptives for females who want to delay pregnancy and or space children. It is one of the most widely accepted methods of contraception in India. Oral administration of small doses of either progestogens or progestogen-estrogen combinations is another contraceptive method used by the females. They are in the form of tablets, hence are popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days, it has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent or retard the entry of sperms. Pills are very effective with lesser side effects and are well accepted by the females. Saheli is a once a week contraceptive pill with very few side effects and high contraceptive value. Progestogens alone or in combination with estrogen can also be used by the females as injections or implants under the skin. Their mode of action is similar to that of pills and their effective periods are much longer. Administration of progestogens or progestogen-estrogen combinations or IUDs within 72 hours of coitus have been found very effective as emergency contraceptives as they could be used to avoid possible pregnancies due to rape or casual unprotected intercourse. Let's see the surgical methods that are advised for the male and the female partner as a terminal method to prevent any more pregnancies. Surgical intervention block gamete transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy, in which a small part of the vas deferens is removed or tied up through a small incision on the scrotum. Sterilization procedure in the female is called tubectomy, in which a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. The selection of a suitable contraceptive method and its use should always be undertaken in consultation with qualified medical professionals. One must also remember that contraceptive methods are not regular requirements for the maintenance of reproductive health. In fact, they are practiced against a natural reproductive event. One is forced to use these methods either to prevent pregnancy or to delay or space pregnancy due to personal reasons. No doubt, the widespread use of these methods have a significant role in checking uncontrolled growth of population. What are the possible ill effects of contraceptive methods? Some people may suffer from nausea, abdominal pain. Some others will be having problem with menstrual cycle. It can be breakthrough bleeding or irregular menstrual bleeding, or sometimes it can lead to breast cancer. With this, we come to the end of today's session. Thank you for joining with me.